My name is Amanda Jelinek, and this is my HEENT video. I'm going to start by scanning the room. Alright. Before entering my patient's room, I would check his chart. Once I enter, I would provide privacy by closing the door or curtain. Then I would perform my hand hygiene and introduce myself. Hello, Mr. Prez. I'm Amanda. I'm going to be your nurse today. Can you go ahead and tell me your full name and date of birth?
Marco Perez, 7988.
All right, thank you. And what brings you in today?
Just a checkup.
Okay. And are you in any pain today?
No.
And are you on any medications?
No.
Do you have any allergies?
No.
Okay. I'm going to just be doing a few assessments on you. You tell me if you have any pain or need me to stop with anything, okay? I'm going to go ahead and start by looking at his hair and skin. Do you have any history of skin diseases or problems?
No.
Any history of rashes or abnormal shaped moles?
No.
Okay. Any skin cancer running in your family?
No.
Okay. His skin color seems to be true to ethnicity. He is nice and warm and dry to touch. He does have some tattoos on his arms and the right side of his neck, but I don't see any lesions or wounds, any scars. He isn't showing any signs of cyanosis or jaundice. For your hair, do you have any history of excessive hair loss or growth?
No.
No, okay. It is true to ethnicity for the color and texture, and it seems to be evenly distributed and appropriately distributed throughout the body. As I continue to do my assessment, I will make note of any changes if I see any abnormalities in the hair or skin. I did ask you a few questions about your name. You told me your name and date of birth. Can you go ahead and tell me where you're at?
At home.
At home? Okay, and can you tell me who the president is?
Donald Trump.
Okay. Shows my patient is alert and oriented ×3. Looking at his appearance, he is nice and erect. His posture and no signs of kyphosis. He is appropriately dressed for the season. His moves seem to be intentional, and for his hygiene, he's nice and clean and well groomed. His facial expression is appropriate and relaxed. His affect is appropriate for the situation, and his thought process seems to be logical and understandable. And as I go through my assessment, if any of that changes, I'll make note in my report. Before I move on, have you had any history of mental illnesses?
No.
Any suicidal thoughts?
No.
And any dizziness? Alright, and so now I'm going to go ahead and move on to your head. Looking at my patient's head, it is normal cephalic. It's nice and round. I'm going to go ahead and feel for any lumps or swelling. You tell me if there's any tenderness. And I don't feel any swelling or lumps or lesions. Is it any of that tender?
No.
No? Okay. I'm also going to check for the temporal artery on both sides. You just turn a little bit. Feels to be a 2+ equal bilaterally. Now I'm going to just test a couple of his cranial nerves. Can you go ahead and raise your eyebrows? And now can you smile, frown, and of his facial features seem to be symmetrical, showing that his cranial nerve number 7 is intact. And now I'm going to test part of the cranial nerve number 5 by testing your TMJ. I'm just going to have you turn so they can see. Go ahead and open and close your mouth a couple times. Alright, and I don't hear any signs of clicking, which is a good thing. And I'm going to go ahead and also test his facial sensation. So if you, when I touch you, I'm going to have you close your eyes. Tell me where you feel it and if it's sharp or dull.
Sharp.
And where at?
Forehead. Dog. Chin. On my cheek.
Alright. And it shows that his cranial nerve number 5 is intact. Have you had any head injuries at all?
No.
Alright, no concussions?
No.
No. And any surgeries on your head or neck?
No.
No. Okay. Moving down to his neck, do you have any neck pain at all?
No.
No. Do you have a history of lymph node problems or swelling? No. Okay, I'm going to go on and now I'm going to actually assess his lymph nodes. I'm going to turn his head so you can see him just a little better. I'm going to start with the preauricular and move on behind the ear to the post-auricular. And I'm going to move back here to the occipital. And while I have you here, I'm also going to do the superficial cervical. And I'm going to have you turn. Okay. And now I'm going to have you push in, or this way, sorry. I'm going to move the muscle and feel in here for the deep cervical. Now this is a little hard to see, and you can bend your head that way. And under the muscle here for the deep cervical. I'm also, while he has his head that way, going to feel for the posterior cervical. You turn your body, keep your head where it's at, but just turn your body so they can see a little better. Right here for the posterior. And I'm going to have you do the other side too. Alright. And you can look straight. We're also going to check the submental right here under the chin. And now you just need to turn a little bit. And move back a little further to the sublingual. And if you move a little bit further back to the tonsillar. And I don't feel any lumps or any palpable lymph nodes. If I did, they should be soft and movable. If they were hard, it would be not a good sign, and we would have to do some further testing. Have you had any history of thyroid issues?
No.
No? Okay. Looking at his neck, I don't see any signs of a goiter or any deviation in his trachea. If he did, I could check his trachea by coming from behind and pushing the trachea to one side and feeling under there for his thyroid gland and seeing if it is large or if there's any deviation to it. I'm going to check your range of motion in your neck. I'm going to have you push against resistance. And on the other side. And shrug your shoulders. Shows that his cranial nerve number 11 is intact. Now I'm going to go ahead and, can you do a little bit of circumduction? Or rotation in your neck. Thank you, showing me that your range of motion is intact. Now we're going to go ahead and go back up to the eyes. Looking at his eyes, his eyebrows and his eyelashes are evenly distributed. Do you have any problems with your eyesight?
No.
No. Have you ever worn glasses?
No.
No? Okay, and do you get tested often, your vision tested often?
Yeah.
Okay. If he had, since he doesn't have any vision problems, it is showing me that his cranial nerve number 2 is intact. If he did have any issues, I could further test them by using the Snellen chart. I'm going to go ahead and look up. Look up. You don't have to look up. I'm just looking at your eyes. Alright, they seem to be nice, and the sclera is nice and white. His conjunctiva is pink and moist. I didn't see any signs of opacities. And if you could just open your eyes so I can check your pupils. They are nice and round. And they are both at about a 4 in size. Now I'm going to go ahead and check the reaction for them. I'm going to check for both direct light and consensual. So I'm just going to come from the side. Alright, and I'm going to also do it on the other side. And his pupils constricted both directly and consensually, bilaterally. Now I'm going to go ahead and have you stare off at the computer, and I'm going to bring the pen light in front of you, and I just want you to focus on it once it's in front of you, okay? Alright, and that showed me that his eyes accommodated. Now I'm going to have you follow my pen. I'm going to do 6 cardinal gazes. Alright, and that shows me that his cranial nerves number 3, 4, and 6 are intact. Now I'm going to go ahead and move on to, before I move on, sorry, I also want to note that his eyes are symmetrical. Now I'm going to move on to his ears, noting that they are symmetrical on the face. The top of his ear is in line with the outer canthus of his eye. I'm going to go ahead and look in your ear. I don't see any signs of drainage, no excessive cerumen, and no foreign objects. Do you have any ear pains at all?
No.
No. I'm going to look on this side. And again, no redness. It's nice and pink. No excessive cerumen or foreign objects. Now, you said you don't get frequent ear infections. Have you had any history of hearing loss at all?
No.
No? Okay. Now I'm going to, tell me if you have any tenderness. I'm going to push on your tragus on both sides. I'm just going to turn so they can see. And I'm going to pull on your pinna and push on the mastoid process right here behind. Was that any of that tender?
No.
No? Okay. I'm going to now do a whisper test. So I'm going to come behind you and whisper something on each side, and I would like you to repeat it.
Jelly. Red.
Alright. And I also have to do one more test. I need you to stand up with your arms on your side and your eyes closed. And this will show your equilibrium is off. I'll move the camera back a little bit so you can see. And alright, you can go ahead and sit down. And he had a positive Romberg's test. He had no swaying at all. He seemed to be relaxed and steady. So that shows that his cranial nerve number 8 is intact with his hearing and the Romberg. Now I'm going to go ahead and go up to your mouth. Looking at his mouth, his lips are nice and symmetrical. There's no signs of any lesions or cracks, and they are pink and moist. Can you go ahead and open your mouth and say ah? Stick your tongue out and say ah. Alright. And just open it a little bit more so I can get a better look. Alright, I'm going to have you, or I'm going to lift your thumb up and this bottom one. Alright. So, from what I could see, his buccal mucosa was nice and pink and moist. His tongue, uvula, his soft palate, and pharyngeal wall were all nice and moist and pink, as well as his gums. His teeth were intact, no sign of any dental work. Have you had any dental surgeries?
No.
No? Okay. And do you go to the dentist often?
Yeah.
Okay. So I'm looking at your teeth. It seems like you take good care of them. Do you floss and brush every day?
For the most part, yeah.
For the most part? Okay. Alright. And when he stuck his tongue out and said, I could see that his uvula rose above midline, and that there was no deviation in his tongue. It stayed midline. That shows me that cranial nerves number 9 and 10 are intact. And then can you say light, tight, and dynamite?
Light, tight, dynamite.
Alright, and that shows me that cranial nerve number 12 is intact. And also, I want to check your tonsils. Can you go ahead and open your mouth one more time? Stick your tongue out. Alright. And his tonsils are about maybe a 1+. Now I'm going to go ahead and move up to your nose. And have you had any history of any loss of taste or smell?
No.
No? Okay. Any nose surgeries?
No.
No seasonal allergies?
No.
Okay. Any frequent colds?
No.
Alright. I'm also, before I get to looking at your nose, I'm going to check your sinuses by touching your frontal sinuses. Any tenderness?
No.
And your maxillary sinuses?
No.
Okay. Alright. Looking at my patient's nose, his nostrils are symmetrical. It is moist and pink. The hair is appropriately distributed in his nose. Can you go ahead and, well, actually I can do it. Go ahead and breathe. And on the other side. And that shows that both of his nares are patent. Looking at his nasal septum, there's no signs of any deviation or perforation. There's no drainage, no foreign objects, no redness. It's just nice and pink. And you didn't have any history of any smelling problems.
No.
If he did have a problem with his smelling, I could put something such as coffee under his nose, or like maybe garlic, and have him guess it with his eyes closed. But since he doesn't have any problems, that's shown me that his cranial nerve number 1 is nice and intact. So I just want to, before I go on any further, make sure I covered everything. I got cranial nerve number 1 with his smell, number 2 with his vision, 3, 4, and 6 with the vision, 5 and 7 with the face, 8 with his hearing, 9, 10, and 9, 10 with his tongue, 12 with his mouth, 12 with his tongue, and 11 with his against resistance in his neck movement. So I covered all the cranial nerves. I think overall I've covered everything. If I had any additional questions, I would ask them now, and I would make sure to go ahead and document my findings afterwards.